EmFace and TMJ relief. Function meets beauty. If you've ever woken up with jaw pain, tension headaches, or feeling that your face is locked in place, you might have experienced TMJ dysfunction. It's one of the most common yet misunderstood conditions affecting the face. And for years, treatment options have been limited. Medications, injections, which we actually do, bite guards, sometimes surgery. But here's what's changing. The same EmFace technology that's designed to rejuvenate facial muscles is now being used to relieve TMJ pain and restore jaw function. I'm Dr. Mathai with Oregon Health TPC, a concierge practice where we do things a little differently. So let's dive in. So the anatomy of that area. So first, let's talk about what TMJ actually is. TMJ stands for temporomandibular joint. It's the hinge that connects the lower jaw, the mandible, to your skull. You have one on each side of your face, just in front of your ears. These joints allow you to talk, chew, yawn, basically every movement that your jaw makes. But the joint doesn't work alone. It's surrounded by powerful muscles. So one, the masseter muscle, it's a thick muscle along the jawline that clenches when you bite down. The temporalis, it's a fan-shaped muscle along the temple. The pterygoids, which are smaller, deeper muscles that control the side-to-side jaw movement. When these muscles become overworked from grinding, stress, poor posture, or injuries, they go into spasms. They tighten, they ache, they limit how much your jaw can move. That's when everyday activities like eating or talking actually become painful. So, how does EmFace address this? Now, the device uses a specialized protocol that is just dedicated for TMJ treatment that combines the two therapies we talked about in our previous video of HIFES and RF. Now, instead here, we are using ultra-low frequency HIFES. So instead of rapid muscle contractions that are used in facial toning, the TMJ protocol uses a much slower frequency, which is about 0.67 hertz. Now, this creates gentle rhythmic stimulations that help tight spastic muscles to relax instead of contracting. Think of it as the difference between doing jumping jacks or doing a deep, slow stretch. The goal here isn't to build tone, it's to release tension. And then you have the synchronized RF radio frequency. And so at the same time, controlled heat is delivered to the treatment area. This increases local blood flow, bringing oxygen and nutrients to the fatigued muscle tissues. The warmth also has a natural analgesic effect. It soothes it causes soothing discomfort and helps the muscles kind of let go and relax. So together, these technologies work like hands-on physical therapy, but delivered with precision and consistency. Over a series of treatments, patients typically experience reduced muscle stiffness and soreness, improved range of motion, being able to open your mouth wider, more comfortably, decreased pain, especially the chronic ache that radiates into the temples, necks, and shoulders. Now again, there's no needles, no medications, no downtime, just 20 minutes of targeted therapeutic radiation. Now, when we look at the science and the safety, there's a lot of awesome stuff up here. So this is not experimental. It's actually an evidence-based treatment. So EmFace for TMJ, it's an FDA cleared, it is FDA cleared for muscle reeducation, relief of muscle spasms, and increased local circulation. These are the same mechanisms that physical therapists use manually, now delivered through advanced electromagnetic technology. Research backs this up. There was a landmark study by Gower and I think Semide in 2015 that found the vast majority of TMJ disorders, upwards of 80%, are musculoskeletal in nature, meaning it's not the joint itself that's a problem, it's the muscles around it, right? And so if we can restore the balance and function to those muscles, we can resolve the pain. And that's exactly what this protocol is designed to do. So here's what's remarkable about the technology. Many people discover EmFace through aesthetic treatments. They come in wanting to lift their cheeks, smooth their forehead, but then they mention the jaw pain that they've been living with, it's gone, the headaches, the clicking. And suddenly, we're not talking about beauty anymore, we're talking about quality of life. EmFace bridges the gap. It's proof that when we restore function, aesthetics follow. And we've always been that in this practice. We're not an aesthetics practice. And when you address the deeper structure, the surface benefits too. So that's the new frontier, where technology meets beauty and biology, and they become inseparable from wellness. I hope this video series has been useful for you guys. If you guys have any questions, again, we are here to help answer any questions that you guys have. Again, this is Dr. Yusuf Mathai with Oregon Health DPC. Again, hopefully this has been educational for you guys. Thank you guys so very much and have a great day. Bye.